People have a beautiful face, beautiful skin, hands, legs. And sometimes when you look down on the feet, they have some cracked feet. So you're taking care of all of your body except a important vital part of your body, that's your feet. Now, many people come over with cracked feet, deep cracks, sometimes very faint cracks. They might have tried off the counter medications, let's say creams like Move and all those things, and try and soften it with some creams, and still they're not able to. Now, coming to why this occurs and how you can manage it is an important aspect. See, sometimes cracking of feet is also hereditary, meaning your parents, grandfather, their siblings, anybody can have a tendency for having a cracked feet. Now, mild amount of cracks, especially on the heel part, is natural for everyone to get. Once you cross the age of 15, 18, cracking of feet is common. Okay, skin gets hardened with time. The more you walk, let's say more activity you're doing barefoot, cracking of feet can happen. Now, some people get it at a very early age. Generally, there's some genetic aspect as mentioned, but there could be other associated factors like something called as palmar and plantar keratosis, or sometimes psoriasis also can present with a cracked feet. Now, when initial cracked feet appearance is there, what are the things you can normally do? Initially, usage of moisturizing creams. There are some softening creams that are available on the counter. Probably using good footwear, a cushioned footwear. See, a footwear that's going in deep inwards without offering any resistance is not a good footwear. It should have a little bit of a thickening. The thickening should be uniform. It should not be like a heel. A thickening should be present. Along with that, a soft foam on the top. So it gives you some resistance as well as a good amount of cushioning. Usage of footwear, especially inside the house, also is useful when you are having a cracked feet. And cracked feet, especially in winter, is more common. So reapplying your moisturizing and probably a foot cream is also going to be useful. Now, what are the dangers associated with cracked feet? If you are a diabetic, cracked foot is it's like a volcano waiting to erupt. Deep wounds or deep cracks in a diabetic patients can be associated with minor repeated infections. And since diabetics also have something called as neuropathy, the sensations are dulled down. Even if the infection presents, the first 3-4 days, they are not able to diagnose it or they are not able to find any symptoms. So they may delay the treatment. And looking at the cracked feet, they may appear normal, but internally they may be harboring infections. So if you're a diabetic, you have cracked feet, it's an impending health hazard. So it's always better you please reach out. You reach out to your dermatologist, you can reach out to your podiatrist also to help you deal with your foot issues. As I told, general measures: moisturize, protect it via using footwear at home and a separate footwear outside. And in case you are, let's say, washing bathrooms, you're using chemicals, again, footwear is very, very important. Along with that, meeting a dermatologist or a podiatrist to help your skin maintain that supplity is very, very, very important. Hopefully this was useful. Thank you for your time.